So for those who are familiar or for you who are just coming in, I'd like to introduce the Climate Resilience Fellowship. So the CRF is a 6-month program designed to upskill 20 young people from Bangladesh, 10 with climate background and 10 from the open mapping community. In this sense, we have paired them to each other in order for them to implement a small community project uh, in their respective selected sites. Through this program, fellows learn to design community-centered climate projects and leverage open mapping as a tool for data collection, storytelling, and driving local action. This program is about more than skills. It's about creating real impact on the ground. Tonight, we showcase the culmination of their journey, the Capstone projects. And this exhibition is a space to learn about their innovative solutions to local climate challenges, see how open mapping empowers community-driven action, and exchange ideas for replication and scaling.
Hello everyone. Now I'm presenting my capstone project. Please, next slide. This is me, Moaz from team 1. Please, next slide. Title of our project is Rain for Resilience, Community-Based Rainwater Harvesting for Urban Slum. Please, next. To initiate our project, we've done several field visits to collect field level data. From field level data, we found that community harvest rainwater using simply locally made collection system. You were seeing in the first picture. In the second picture, people harvest rainwater using simple household containers for drinking purpose, using a cloth over the drum. In the second picture, you saw. In the third picture, you are seeing that people's household members, families enables to use collected rainwater for their daily needs purpose. One of the household members doing bath using rainwater, harvesting rainwater. Please, next slide. To implement or execute our project, we done need assessment. We found that families spend 3 or 4 hours daily for collecting waters. There's huge level time losses in a day. Another things is household pay daily basis 50 to 55 BDT, which is really a burden of a low income family purpose. And the third things is social vulnerability for collecting water for daily drinking purpose and daily needs purpose. Women and children faces losses times and their safety, dignity, and many opportunities, especially children's, especially women children's. They do not go to school, access to education. So this is the social vulnerability purpose we found. Please, next slide. This is the implementation process, overall project scenario. To implement a rainwater harvesting system, we did several field analysis to choose a suitable rainwater harvesting system place. After the install the system, we done several monitoring and a feedback session that how the system should be utilized or maintained. So overall maintenance purpose we shared through collected learning and sharing knowledge purpose session. Thanks. Next slide. To analyze the impact of our project, we can say that according to Chattogram City Corporation, there are 1.5 billion people across 435 informal settlements in the city corporation area. So if each settlements adopts this model, we think significant number of families could access harvest rainwater. Next slide, please. About sustainability purpose of our project, we can say that the approach should reduce illegal water connection. That should definitely significantly support Chattogram Water Supply Sewerage Authority (CWASA) about non-revenue water purpose, because CWASA losses huge level NRW losses in their water supply connection purpose. And second one is about through public, private, and community partnership. Tanks can be replenished during dry months from legal water sources, ensuring continuity of supply. So, in the monsoon season, they can harvest rainwater from the natural sources, and even the dry seasons, dry months, they can harvest it through another source, another water source that should be come from public-private community partnership process. Another slide, please. Overall outcome of our project, our rainwater harvesting systems, which store 5 liter water, 500 liters, sorry, 500 liter. And from the rainwater harvesting system, 25 people supported, and also 25 people trained how to manage, how to maintain the overall system, and to commute all the people. We formed a user group, and also the chair of that group who maintain, who uh, facilitate overall the system. Thanks. Overall, this is the ending of the presentation.
Humanitarian OpenStreetMap Team, Open Mapping Hub, NetHope, World Vision. We sincerely thank you for giving us the opportunity for be a part of Climate Resilience Fellowship. In today's session, we would like to showcase our project, which is MeghBondhu, an interactive interface which is a climate guru and also a climate advisory platform. So we are Team 6, Mashiat Ronak Pritam, me, and Zarin Sabah. So yes, so our project figured out some problems in Dhaka slum, and our target area is Duaripara, Mirpur. So the communities are vulnerable to heat stress, waterlogging, storms, sanitation, and waste disposal. They lack the knowledge and information and alerts, specifically community based. So there are limited dissemination of information related to climate change and local diseases and illness among them, which hampers their health, livelihoods, mobility, because they're not prepared. So you can see the study area map, the Duaripara slum area, the waterlogging in Duaripara slum in 2024 is all monsoon period is also mapped using Sentinel-1 SAR data. So we identified the problem through household survey, focus group discussions, and random visit to waste disposal sites and waterlogged sites. And our targeted household is 30. So our solution provides a climate-informed local language chat interface, provides real-time weather alerts related to heat, waterlogging. It provides health advisories. And this is an interactive interface. We used Bangladesh Meteorological Organization data, OSM mapping tools, and surveyed 30 households in the Doribora slum area. Tested prototype. This is our flow chart. FGD, household, and KIIs. We included climate projections using statistical analysis, developed multi-sectoral expert advisory on weather streams. We thought to build a chatbot, but due to lack of time and funds, we shifted to the interface. And inshallah, if we get the fund in the near future, we will work on developing the chatbot. So here is the website for our dynamic interface MeghBondhu. You can see it has the recent weather information, future climate projections for the 5 years 2026 to 2030. There are advisories and also clinics. So using WebGIS and OpenStreetMap, we have mapped amenities, households, waterlogged zones in our particular study area on the right side of Dwaripara slum. And here you see the climate projection from 2026 and the advisories. And advisories will gradually change based on weather, illness, and other disasters according to the community needs. So what are our outcomes? We have able to build a timely alert on heat, rainfall, storms to cope up with the climate shocks. And we have built our interface prototype, took training sessions and co-design workshops, mapped amenities, waterlogging zones using OpenStreetMap, strengthened trust and adaptation through inclusive engagement, and served 30 families. So here is a view of our workshop and community engagement. It was an hands-on training and learning session. Our community materials are inclusive and children-friendly. You can see. So scaling, we would like to scale to 300 household clusters in the slum areas, enable dual reporting and responding, integrate large language model for localized advisories. The thing we couldn't do in short of time and funds, if we get the fund, we will try to launch it for WhatsApp, Messenger, and Telegram. Funding for hosting a server and changing the dynamic designs, enhancing accuracy in UX. And if it is possible, it is inevitable to say that it is the Bangladesh first community designed climate companion tool. So I would like to conclude with a quote: every community deserves dignity, safety, and the right to be heard, no matter the postcode. So let's come together, take part in humanitarian action, and build a sustainable, healthy, equal world where all peoples, including the some community members, live a peaceful life. That was from me. If you have any inquiries or questions, you can mail or knock us. We will be willing to answer all the questions. Thank you.
Okay, so welcome from Team 10, me and Nusrat Jahan Nilima. Next slide, please. The project we have implemented is named as a household-led heat resilience measures in Dhaka slum areas. We have done this project in a small slum areas. Okay, next. Okay, so the main challenge the project we have done in the considering the challenges that like millions of people are living in Dhaka in an informal settlements. That's our living under the shade of an heat conductive tin shed roofing system. And the problem is the indoor weather or environment or living condition is not very much good, and people often have to compromise with their health, productivity, and basic living conditions. So the projects, like we have tried to tune or find some low scale solutions to make their living condition a bit more better. I will not say that a lot, but a bit better. So that's our target. So next slide. So we have tested so we have do 4 types of trial. The first one is we use PVC board under the tin shed, and the second was we use P foam. It's also beneath the roof shed or tin shed. Third one is we have used enamel paint above the, like it's a coating system, 2 layer coats above the roof. And the fourth one is that this one also a kind of paint, but it is roof guard, which is specially made for the concrete. But we have tested it with over the tin shed, like it's a trial. Next slide. Okay, so our main sample size is 13 household. We covered a full like the very small slum areas fully covered. So there are 13 households, and we have do the test for 45 days. Like we regularly take the temperature reading under these 4 types of experiments and collect and record this data as is mentioned over here, the morning time, noon time, and afternoon time. And our key measuring value is the is delta T, like the means the difference of temperature for where the solution has been applied and where not the at the raw room. So we both at this point we take the both temperature reading for applied 4 solutions. So I will invite Nusrat to present the next slides. So thank you.
Thank you so much. I would like to please come to the next slide, please. We now move on to the most critical part of our research, the impact analysis. Our baseline temperature reduction, what an untreated tin room achieved naturally, was about 1.1 degrees Celsius. The metric we focus on is net delta temperature, or the temperature difference improvement, which is the additional cooling provided solely by our solution. The results are striking. We found 2 clear winners. Solution 4, the specialized roof guard paint, achieved the highest net cooling benefit of additional cooling, or 0.988 degrees Celsius to be very precise. And the solution 1, the PVC board false ceiling, was a close second one, achieving 0.960 degrees Celsius. These 2 structural and coating solutions significantly outperformed the others. For context, solution 2, the P-foam, offered minimal benefit with only 0.287 degrees Celsius. This tells us that a high-quality barrier or specialized reflective coating is very essential. Next slide, please. To understand this solution better, we analyzed performance across the day, which revealed important notions. During the midday peak, 12 p.m. to 2 p.m., when solar intensity is highest, the PVC board, the solution 1, was the strongest performer, providing 2.43 degrees Celsius of cooling. The physical air gap created by the PVC is highly effective at stopping heat transfer at the most critical time. However, when we look at the morning and the late afternoon, as temperatures are rising and falling, solution 4, the roof guard 1, showed the superior consistency and robustness, slightly edging our solution. This indicates solution 4 is less influenced by the outdoor temperature fluctuations and provide a more stable indoor environment throughout the day. Next slide, please. While solution 1 provides the best midday performance, our mandate is scalability. To determine this, we performed a cost effectiveness analysis, calculating the cooling achieved per 1000 BDT spent. The PVC board, the solution 1, is expensive, costing 5,925 BDT per house. This made it the least cost-effective option, offering only 0.162 degrees Celsius per 1000 BDT. It is simply not viable for large-scale slum intervention. And the second one, the roof guard pane, solution 4, costing only about 1075 BDT, emerged as the clear efficiency winner, providing 0.919 degrees Celsius of cooling per every 1000 BDT, nearly 6 times more efficient than the PVC. Next slide, please. Based on the comprehensive analysis, our team has 3 clear recommendations for the next phase. Prioritize and scale solution 4 or the roof guard 1. This is the optimal solution for widespread deployment due to its high overall impact and superior cost effectiveness. This solution is financially sustainable for community-led programs. So, and second one is the utilize solution 3, the enamel paint, as a second option. It provides moderate cooling at a similar low cost, serving as an excellent entry-level alternative. And the third one is the reserve PVC board or the solution 1, only for critical cases where budget is unrestricted and maximum midday performance is an absolute necessity. By prioritizing solution 4, we can deliver the maximum heat resilience impact to the greatest number of people in Dhaka's vulnerability communities. Thank you. We are open for your questions.
Thank you very much. Yeah, next slide. So this is from teammate project 4, and myself Hasan Habib Simon, and with my teammate Muhammad Azhar Islam. So good evening, everyone. We are pleased to present our Capstone project, which focuses on strengthening urban health resilience and identify household level health risks through participatory map. Next slide. So our project title is Healthy Homes, Safer Futures, a capacity building initiative for health and hygiene in Mirpur area, Dhaka. Next slide. So you can see the challenges and problems that we identified in the community. Dhaka's urban settlements, especially areas like Mirpur, face significant public health challenges, and community lives in the densely populated areas and with limited access to clean water, poor sanitation, and waste management. And there is also inadequate infrastructure to, and limited access to wash, while health awareness and promotion remain limited. So nearly from the data that 0.88 million people are at risk, constant health risks, especially the women, children, and elderly, and around 34% face preventable diseases, primarily due to unhygienic living conditions. Next slide. So this is also the same picture, but this is the diagram of disease outbreaks, how visible cases of disease are occurred. So in the below one, you can see that the impact of climate change worsens and exacerbates the current situations and conditions of the community. Next slide. So through identifying the health risks, we trained the communities through capacity building programs, and also we have done hands-on disease prevention skills training, and after that it improved their health and it lasted their behavioral change and resilience. Next slide. So this is the project area that we have covered. You can see the red inside the red line. There, these are the area that we have covered, and you can see also the red point. And the black line is the whole area. Next slide. Next slide. Okay, so through capacity building trainings, we have actually trained them addressing safe water, cleanliness, and hygiene. And also we have conducted participatory mapping, and also we trained the youth and also the women how to collect data using toolbox, and also upload them in the server so that they can also have the free access to that area. And also we provided hygiene materials so that they actually do the behavioral change practice, and it such improved the health condition of the community. Next slide. Okay, so data is I don't know, it has changed the structure. Well, these are data from we have collected from the participatory mapping. You can see that, I don't know if you don't see 89% women shared that they have shared toilets with men, and 4% have no toilet facility at all. The below diagram, the pie chart, out of the 378 respondents of women, they tend to go 50% of them shared that they tend to go government hospitals when usually they need the treatments, and also 40% go to the private doctor. And in the right side, there is no the text. Well, these are actually the maximum respondents said that they have less clean, they have less amount of clean water, and also sanitation, and also the sanitary pads and water, less water for cleaning. Next slide. Okay, so the first one, out of the 335 respondents, the overall family, indeed, they said that 49% said that the toilets during floods or heavy rains are safe. 40% said unusable, and 11% sorry, 40% said overflow, and 11% said unusable. The right one, we have identified the most disease or the health problems. The first one is diarrhea, the second one is dengue, chikungunya and malaria, and the third one is stomach pain due to drinking of the unsafe water. And we have found that estimated that average monthly household cost for health treatment took BDT 1,010 taka. Next slide. So this is our inclusion of the JETC strategy. Next slide. Okay, so we have developed a dedicated website where we have included all of the data. This is the interface of the website, and also anyone, it is free and interactive. Anyone can actually click on the map, and they can have the more details of the particular amenities, the particular roads, particular what are the specific health problems, issues, and also they can also upload the data. But we will check the data, and after then we can confirm or include in the map. Next slide. So our outcomes actually is we have reached 400 families, and 8,200 plus people we have engaged, and we trained 22 people, and members engaged 6. Okay, next slide. We have less minute. Okay, so recommendation for next phase is we actually covered 20 direct beneficiaries, but we target to 100 beneficiaries, 378 families to 1,000 families. And as we have a website, so we need to maintain it, we need to update it, upload more data, and also maintain all of the activities. So that's why we need more funding to continue our project. So thank you very much. Next slide. This is all from our side. So if you have any questions or any suggestions, please let us know.
Okay, thank you so much, and Assalamu alaikum, Radaf. This is Mainuddin and my teammate Brother Singh. So greetings from our team. Next slide, please. Actually, our project name was OSM Academy, empowering youth and volunteers in Dhaka slums to tackle climate vulnerability, especially heat waves, by developing localized tools, training materials, and providing capacity building trainings through a dedicated website. Next slide, please. Okay. We know when we want to implement any project in the field, first time we need to understand the field context and need to identify risk and need baseline survey. So we conduct a baseline survey and try to understand field context. So when we conduct a baseline survey, we identify some problem statement. You can see here first government advisories, general government heat advisors. Second হচ্ছে youth unemployment, technical climate literacy skills, Bangladesh. Actually, we get this information from our basin survey. Youth unemployment in the slum have Bangladesh youth unemployment rate 12%, and vulnerable residents, high risk of illness, death, elderly, pregnant women, and children at risk. Mapping deficiency, real-time accessible maps, less than 1% of slums mapped. Temperature rise, extreme heat events surging. Dhaka's team has increased by approximately 0.6. Disaster response, efficient resource development, inefficient disaster response resource. Next slide, please. Okay. Actually, our project primary location in the Rupnagar slum. So first time we conduct baseline survey here and understand Rupnagar slum's context. We especially try to understand their people's education level and first time we complete our some mapping tools. Please, next slide. Actually, how we work in the slum communities. So here we show baseline survey and polls. So first time we conduct a baseline survey and understand the slums context. Then we take next step, awareness and resource. We conduct more of training in the slum and share with our heatwave patterns and early warning and setup. Actually, you know, our website name OSM Academy is is a warning system, is a heatwave warning system, and we make on website for early warning system. Door-to-door first aid. When we conduct a session, that time we distribute some hygiene kits in the community peoples. Next, and we try to make proper documentation, our all projects, pictures, and our reports. Next slide, please. Hand over to Brother Simbai.
Thank you so much, Manuddin Bhai. And yeah, so basically, to power the workflow, we launched OSM Academy, a platform focused on empowering youth to take on climate vulnerability. So basically, this academy serves as a central knowledge hub. We provide easy multilingual access to heatwave risk description because as we are working in slums, so I think a local language is mandatory. So we added multilingual system. And crucially, it provides capacity building through dedicated hands-on open mapping training, certifying young community members in geospatial data creation and maintenance. And finally, it features a real-time safety dashboard, a live advisory system that shows the community's current risk status, like green, yellow, or red, which will enabling immediate coordinated action when temperature spikes. Next slide, please. Okay, so basically our outcomes. So our first outcome was digital footprint, the result of our pilot project speaks for themselves. We didn't just talk about resilience, we built the foundation for it. We successfully closed the information gap, converting a blank spot into a data rich, actionable zone. We achieved 100% boundary mapped status for the pilot area. We verified 35 plus critical point of interest, places like water access points, clinics that are now visible to the UMAP dashboard of the from the Dhaka Climate project, which was built by Hot and Open Mapping Hub. And we completed surveys for 265 households, giving us granular data on vulnerability and population density, which is vital for target relief. Next slide, please. Okay, so beyond the data, our most valuable impact is the human capacity we build. We certified 6 youth leaders as core volunteers in the entire open mapping workflow. They are now the local custodians of this data, ensuring its accuracy and longevity. Even more powerfully, we trained 220 women as household level heat awareness communicators. Basically, these women are the first line of defense, empowered to recognize early symptoms and take immediate action within their families and neighborhood networks. Next slide, please. Okay, so if we talk about the health and safety outcome, this project went beyond mapping, it delivered direct relief. Through our community teams, we successfully distributed 150 heat kits containing ORS. Yes, okay. Containing ORS hygiene items and temperature reference cards. We deployed the live activity dashboard successfully during 2 high temperature periods. Most importantly, we have validated the model. This entire framework, the mapping, the training, the workflow is now proven and ready for replication across the more than 100 other slum communities facing similar threats. So next slide, please. So we are looking forward. We have clear objectives for scaling our solution. As you know, we basically work in 5 steps. So basically, our scaling goal include expanding coverage to all major Dhaka slum communities, integrating simple low-tech solutions like SMS-based alert system to bypass smartphone dependency, and continuously training additional youth volunteers. So we want to train more youth, so that the project will sustain. To achieve this, we need support. We are currently seeking funding to move the dashboard from a pilot stage to a robust server infrastructure. We require committed access to up-to-date data, urban data from city authorities, and we need we need institutional partnership to help us achieve citywide implementation. So we want to reach a broader audience. We want to cover all the slums in Dhaka. So that's our need. Next slide, please. So if you have any question, please feel free to ask me, or you can visit our website osmacademy.org. Thank you.
All right. Hello, everyone. We are Sumaya and Ifat from Team 9, Project 7. And today we are really excited to present our project Map for Resilience. If we go to the next slide. We are part of the Climate Resilience Fellowship, working at the intersection of community resilience and environmental sustainability. Next slide, please. Our project focuses on creating a community-led West resilience model through women's leadership, youth engagement, and circular economy innovation in Shahpuran Slum, Mirpur. And who we are, I am Sumaya, sustainability researcher working on environmental science, air pollution, and waste management. My teammate Ifa is a sociologist specializing in climate resilience and gender justice. Together, we designed a model that combines a community empowerment, a community that empowers environmental impact and sociology as well. Next slide, please. Okay, so let us come into the project summary. So Map for Resilience addresses a major gap in Shahpuran Slum, which has poor waste system, plastic pollution, wash challenges, gender exclusion, and youth disengagement. So we integrated women's leadership, youth photo voice, GIS mapping, of course, and the PLASPIN circular economy model to create a meaningful change. Next slide, please. So before explaining the model, here's what we achieved in just few months. We reached 700 households listening to their daily struggles with waste and sanitation. We trained around 120 women, not only in segregation, but in leadership, helping them recognize their power in community decisions. We supported 30 youth members, turning them into photo voice storytellers who captured their environmental issues or adults often overlook. And through our PLASPIN model, the community recycled 115 kgs of plastic, all validated by Garbage Man Bangladesh, our partner, and two extraordinary women, one aged 19 and another 55, stepped up as community leaders to run operations. And every household involved 100% endorse the PLASPIN model as they trust. Even the income generated was reinvested right back into the community, completing a true circular system. Next slide, please. So let us have a look into the background and problem we saw in Shahporan slum. Shahporan faces informal, inefficient waste systems, clogged drains, and disease risks and high plastic pollution. Women manage waste daily, but are excluded from decision making, as we all know. And youth have potential, but lack platforms to contribute. And our project definitely brings women, youth, and recyclers together in one circular system. So if we go to the next slide, we will see a brief objectives that we have. Yes. And if we go to the next slide, please. So we engaged women household managers, local youth, informal waste workers, Garbage Man Bangladesh, and volunteers, and 700 households in total as our stakeholders. Next slide, please. So here is exactly how we carried out our intervention. So I'll pass the floor to Ifa.
All right, Sumaya, thank you so much. I hope everybody can hear me. So next slide, please. To start with how we conducted the baseline and end line, we conducted baseline and end-line surveys in 700 households supported by 20 trained volunteers. We assessed waste practices, gender roles, and community perceptions. We also conducting FGDs at the same time to understand like what kind of brewer they would prefer and the details. And the next slide, please. Our interventions included women's training, youth photo voice training, implementing PLASPIN model, and the GIS mapping. Together, they formed a structured, community-driven waste management system. To the next slide, please. So this is the report generated by Garbage Man, and I have also added the link here. You can see the whole report provided by the Garbage Man. Due to space issue, we couldn't add the whole thing, but you can see how it also contributed to recycling system as well. To the next slide. And this is the map for resilience web maps, like our study area that we created with the support of one of our volunteer. And if you click onto this, you will see the whole descriptions of our project, who contributed to this map. And it actually includes the whole Shahporan slum area and the households where we conducted the surveys. Next slide, please. So the women's training part, one participant, age 55, actually told us that we thought our responsibility ended inside the home. But today we realize the community is also ours. So moment like this actually showed the power of women-led resilience that we actually wanted to portray. To the next slide, please. So this is one of our highlight as well. We trained 30 youth in photo voice under the theme Through Our Eyes, Our Story. Instead of complaining about environmental problems, they actually became evidence collectors, documenting real waste hotspots and proposing solutions. Their work resulted in 18 actionable insights for advocacy. To the next slide, please. This is just a look for you to see what kind of training materials we use. So we developed accessible Bengali language materials on waste segregation, leadership, and youth documentation. To the next slide, please. And over to Sumaya.
All right, thank you. So now I'll explain the PLASPIN model, the core circular economy component of our project. PLASPIN stands for, as you can see, plastic, sanitation, participation, inclusion, and innovation. So we wanted to combine all of these words. So women leaders coordinated plastic collection, sorting, and data entry in our system. And Garbage Man Bangladesh recycled the materials that we collected and provided official validation. And the best part, the community is very happy to get household products in return to their plastics. They never thought that something like plastic can be sold to us. So the impact factor we can see 115 kg plastic recycled, 2 female leaders managing operations, the income completely reinvested, and 100% household indoors through our surveys. So PLASPIN shows that a slum community can successfully run a woman-led circular economy model. So the next slide. So this is a slide about our smart metrics. So we exceeded nearly all smart metrics targeted, 120 women trained, 30 youth trained, and 144 kgs of waste collected, and 115 kgs recycled, and 700 household engaged. So if you see the picture on your right side, so this is a before and after picture of our PLASPIN model. So the roads were actually looking cleaner and better in the pictures and in reality as well. So the next slide, I'll pass over to Ifa.
Yeah, thank you so much. If we see at the outcomes, these are the outcomes that we wanted to portray. And over to the next slide, please. Some of our findings from the household surveys. To the next slide. And the next slide, please. Next slide. So for sustainability, women leaders will actually continue the PLASPIN operations. Youth will keep documenting, and our partnership with Garbage Man Bangladesh remains active. For scale up, we actually plan the expansion into 2 more slums, CSR collaboration, and policy advocacy for community-led circular economy models. And right now, let's actually conclude by watching a short video that we captured. And I just hope that you will give us the time to actually play this video for you, because seeing is believing, and I believe this video can show you what we did. Please play the video, and that is it from our side.
Dhaka, a home to many informal settlements, communities that face daily challenges like poor waste management, limited climate education, and fewer opportunities. For our Map for Resilience project, we focused on the Shahporan slum. We began by conducting surveys to understand the community's need and realities. Our project started by training the youth and women, empowering them with climate knowledge, leadership skills, and hands-on waste management techniques. Through our PLASPIN initiative, the community collected and recycled 150 kgs of waste. A woman leader led the process, and the recycled materials were sold, allowing families to receive useful household products.
We want to create an atmosphere যেখানে ওয়েস্টের মাধ্যমে মানুষ ওয়েলথ পাচ্ছে, and we believe this circular economy is the best version for Bangladeshi community.
হ্যান্ড ওয়াশ দেওয়া হইতেছে, পাউডার দেওয়া হইতেছে, মানে মানুষের যে একটা পরিচর্যা, যে মানুষ পরিষ্কার থাকতে হবে, হাইজিন থাকতে হবে, সেই জিনিসটা এখানে তুলে ধরেছে, মানে মানুষের অভ্যাস চেঞ্জ হয়ে যাইতেছে।
We also introduced the photo voice method, training young people to document waste issues in their surroundings.
We wanted to utilize photo voice, and we wanted the voice of the community through their submissions. And the best way to do that were through the youth, who actually is more exposure to the technology and also to smartphones and as such.
Finally, through ongoing climate education and leadership training, we build a community capable of taking action on its own, ensuring long-term sustainability.
Okay, Assalamu alaikum and good evening everyone. We are Team 8, Farhana Musarin and Halima Akhtar. And today we are honored to present our project TapoSurakkha, a mobile-based solution designed to strengthen heatwave resilience and community awareness in Bangladesh. Next slide, please. As heatwave becomes more severe each year, many vulnerable groups, especially slum dwellers, outdoor workers, children, and the elderly, still lack access to timely heat-related health information. This gap puts community at serious risk. TapoSurakkha is a heatwave resilience app that enhances community safety through digital tools, as most households in the slum already have mobile phones and many homes have already Wi-Fi connections. The app becomes an accessible and practical solutions for delivering timely information. This app supports tech-enabled volunteerism, allowing volunteers to rapidly share updates, engage community members, and assist vulnerable households. It strengthens community-led support networks, promotes peer-to-peer education, and facilitates on-ground awareness activities. Through mobile-based learning and low-bandwidth tools, TapoSurakkha ensures that community remain informed, prepared, and resilient during heat waves. Next slide, please. To ensure our solution respond to real community needs, we conducted 3 field visits in Moshar Bazar, Korail, Slum. During these visits, we conducted community meetings, organized awareness session on heat-related health risks, carried out user testing for our prototype, collected feedbacks to refine our solutions. We recruited 10 community volunteers and provided training that equipped them with heatwave awareness knowledge skills to use the TapoSurakkha app. Basic OSM mapping skills, these volunteers now act as community educators. We developed a low bandwidth Bangla prototype designed specifically for undeserved communities. This app includes real-time heat alerts, safety tips, first aid guidance, offline features, and easy navigation for low literacy users. Next slide, please. Here you can see photos from our 3 field visits, where during our first field visit, we aim to identify a dedicated community worker actively involved in local development. There we met Ruby Appa, who has been volunteering with various organizations such as UNDP and BRAC for over 25 years. She expressed great enthusiasm and interest in collaborating with us. In the second field visit, we conducted an awareness raising session on heat wave and heat related illness. We also introduced our idea of developing a mobile application and collected valuable feedbacks from the community. Finally, during our third field visit, we installed the app on their phones and provided hands-on training to ensure they could use it effectively. With this, I would now likely to hand over to Halima Apu, who will continue the next part of our presentation. Thank you.
Thank you, Farhana Wishi. Thank you so much. So the presenting part of mine, you can see. Please, next slide. Okay, the core app interface features. We made it fully accessible in both Bangla and English to ensure that local residents, especially vulnerable groups, can easily understand and use it. And the app provides real-time weather forecast, a 7-day outlook, and quick access to essential safety information, including heatwave alerts, emergency steps, and OpenStreetMap-based location features. Next slide, please. In the next section, we focused on awareness building. Many people in Bangladesh have heard the term heatwave, but not everyone understands what it means or how it affects health. So the Korail slum area people, they are the focused community members. Our app includes simple visual explanation like what is heatwave, types and causes, common symptoms, age-wise precautions. So next slide, please. The impact of the project. Through the pilot implementation, we observed several meaningful impacts like strengthen community awareness, local capacity building, technology adoption, improved risk understanding through OpenStreetMap, and most importantly, enhanced community readiness. Overall, the project helped increase preparedness for future heat events. Next slide, please. Scaling up. Now I will briefly walk you through how this heatwave resilience project can be scaled up. At the center of our approach is a set of practical and community-focused scaling strategies. First, we focus data-driven refinement. We plan to continuously analyze user data and integrate community feedback to improve both the app and the field activities. And community expansion is another focus. By reaching more neighborhoods, especially high-risk areas, we can increase user risk and ensure that vulnerable groups benefit from early heatwave alerts and guidance. OSM mapping, like training more volunteers, and finally partnership building, collaboration with local NGOs and government department will help institutionalize the initiative and secure long-term sustainability. Next slide, please. In conclusion, the pilot phase of TapoSurakkha has shown very promising result with 3 field visits, trained volunteers, and 7 app installation. We have seen a strong early community engagement. The OSM-based mapping also helped us identify key heat risk hotspot, enabling more focused planning. The project contributes directly to SDG 3, SDG 11, and SDG 13 by improving community health, building safer and more resilient cities, and strengthening climate action. Next slide. Next slide, please. Okay, thank you for your attention. I'm very happy to take your questions now, and I particularly welcome any recommendations on how we can strengthen the project further and scale it more effectively. Thank you.
Hello everyone, I'm Faiza Waziha and I'm representing Project D-PACT, the Defend, Prevent and Act Together for Community Resilience, alongside with my teammate Risatara Mim. So for next slide, please. Yes, for our short introduction, I'm again Faiza Waziha and I'm working as a research intern in Save the Children Bangladesh, and Risatara Mim is working as a young professional in humanitarian and disaster risk reduction sector. Next slide. So in our project, we focused on Jilpar Slum in Mirpur 7, a community living in the front lines of climate change. So in the beginning, we didn't just want to we didn't want to just do a cleanup. We wanted to build a system. So we asked, how can we use geospatial data to protect a community that is often invisible on the map? So in the reality, it is very harsh. In 2024, the Bangladesh experienced worst dengue outbreak with over 100,000 hospitalization and 500 deaths. But the data for slum is often missing. And next slide. From our baseline survey, we have found that 58% of Jilpar households suffered from mosquito-borne diseases in just last year. And despite this, 80% still rely on most of the time ineffective and harmful mosquito coils. And they are also facing waterlogging and diseases without any data-driven defense. And next slide. So our D-PACT project responded with 3 phases, which is assessment, awareness, and action. Next slide. So in phase 1, we mapped the unmapped using, next slide, please. So we mapped the slum using the tools like Kobo Toolbox and Mapillary, and we identified 75 unique features, pinpointing 20 mosquito breeding zones and 12 open waste disposal points. Next slide. And from our UMAP dashboard, you can see that we converted this raw data into the map. And next slide. And we also created the mosquito breeding hotspot also. And by this, we transformed a vague health risk into a visible, actionable intelligence. And next slide, please. But with just the map on a server, it doesn't actually save lives. So in phase 2, we took the data back to the community, and we showed residents that their own homes on the map, pointing out the high-risk breeding grounds right next door. And we trained youth and women to identify larvae and manage waste. However, awareness is just a spark. To explain how we turned this spark into physical action and youth leadership, I hand it over to Risat.
Thank you so much, Faiza. So moving forward to the next slide, we have our activity called Local Youth Dialogue, where we have engaged young people from the local slum community who were just 15 to 25 years old, because we had the objective to hear from the young perspectives, their voices, their solutions, and their recommendations. They want to see in the future in their area. We have also called upon some community-based organization members, especially women members, who had shared their views on the overall current situation and solutions that needs to be done. Next slide, please. Moving forward to the community action part, we had engaged the young people of the slum area, where we have engaged them into slum cleanup activities, and also making them plant mosquito repellent variety of species, for example, basil, mint, neem, lantana, etc. And they were very much engaged in working for their own community. And I have seen young people saying that they would like to continue this kind of work in future if they can get the opportunity. Moving to this next slide, where this is interesting. We had the opportunity to take an awareness session of the young people, and we had introduced a DIY session where we tried to make them understand how they can use their household ingredients into natural mosquito repellent items which are available at their household, and they can use this very frequently to prevent mosquito breeding zones and the hotspot that we have identified in the slum zones. And also we have validated the mapping part through the local young people, and we have actually taught them how to do interesting mapping, how to actually use mapping gadgets, mapping apps, and which was kind of interesting for them also to learn. Next part, the next slide, please. Okay, so now comes the outcome part. So if we see, we have a group of young mappers who worked on identifying 20 dengue hotspots, 12 waste dumping zones, 26 community wash facilities, or 14 water facilities, and 1 healthcare facilities in their own slum zones. And now they have a clear map of where their slum is located and what kind of facilities they can easily access and what kind of prevention measures they can actually take in their slum region. And also we have formed a task team of 8 to 12 youth and women members who are now responsible of follow-upping their community actions and supervising all the measures and distributing the measures that we have taught them. Now we have also seen that the community-led cleanup efforts and natural larvicide applications and plant repellent installation have contributed to a measurable reduction to mosquito breeding sites in the slum zones. The 20 dengue hotspot zones have come down to a lower level during the August and September months. We have directly engaged 70 plus community members, including more than 50% of youth and women who have participated in climate health and vector-borne disease prevention sessions, improving their knowledge and awareness levels by 30 to 40% after our post and pre-evaluation. Next slide, please. So what's next for D-PACT? Well, D-PACT wasn't just based on vector-borne diseases prevention. It's a resilience movement for every hazard a slum community endures. So for D-PACT, we want to develop and adapt awareness modules to cover fire safety, heatwave prevention, flood and earthquake evacuation, which is much more needed for a slum situation. And we also want to activate a multi-hazard community fast responders, especially the youth and young people, who can actually conduct regular follow-ups, environmental monitoring, and they can actually be the base of their own slum development. And we will also like to introduce hazard-specific micro-interventions by the local youths. And when we were conducting the local youth dialogue, they had amazing small piloting initiatives that I think if that can be initiated, that will be benefited for all of them. So lastly, whenever there is a hazard, we believe that D-PACT will act. Moving forward to the next slide. D-PACT wasn't just an 3-month project. It is an spirit that we have put it in the minds of the slum youths, and this is the video that we want to cheer up. Thank you.
Hello everyone. It's a very good night as it's night time in Bangladesh. Next time, please. Next slide, please. So let me introduce to our project. Our project is entitled Empowering Communities for Climate Resilience, a participatory approach to waste management and water clogging in Ershad, Nagar, Tongi. Here is a group photo of our last event. Next slide, please. So let me introduce my team. This is the work led by myself, Asif bin Alam Siam, and my project partner, Nafisa Nandani, alongside a team of dedicated volunteers and community members who believe that waste is not just a problem, it is a resource waiting to be managed. Next slide, please. First, we identified a problem, and as we visit the areas, we identified few problems. We found out that only 31% of the households are actively segregating waste. When the monsoon hits, the water rises, the carrying disease into the homes. And lastly, and not least, the disproportionately impact on women and children who manage household sanitation, yet are historically executed from waste governance. The system was broken and the community had no ownership of the solution. Next slide, please. Considering this, we targeted an area that called Ershad Nagar Slum, situated in Ershad Nagar Tongi area. So we selected a zone as we have budget constraint. We visit the area and we selected the area zone 3, as you can see in the map. We targeted 50 households and identified women and youth as our community resilience champion. Why them? Because they are the ones suffering the most from waterborne diseases like dengue and other diseases. And we discovered that they are the ones most motivated to lead this change. Next slide, please. First initiating the progress, we done some need assessment. We surprisingly found that their knowledge about waste segregation and climate resilience is not primary level. That we can say that they are intermediate level. They know the things, but they don't know exactly what they can do with it. So first is graph, we can see the main ways of separating waste. We found out that they are not separating waste as they don't have a separate spot for segregating. And secondly, we found out that the waste segregation and the waste collection from their area that is only happening 2 or 3 times a week. And lastly, the lasting water clogging. We found out that in the monsoon season, they really face the problem of water clogging, and the water clogging lasted to 1 to 6 hours to them. And proper knowledge about waste management and health problem, we found out that their knowledge about it, we saw that they agreed that waste management leads to many health problems. And last 2 was their willingness to waste management training and climate resilience building workshop. We found out to 100% of the participants that they want to initiate or participate in the workshop. So we selected 15 of them for our next phase of the project. Next slide, please. Here is our map. This map was done by our project member Nafisa Nandani Apu. We depicted the area of zone 3 of the Ershad Nagar Slum. We do some hazard mapping. For mentioning that, we found some hazard like open drainage, illegal waste dumping areas, and export waste. Good to know that we initiated this mapping, and we found out around 25 open drain and 20 exposed waste and 5 exposed waste dumping stations. And aside that, we opened a tasking manager so that we can map the area properly. Next slide, please. Yes, here is our incorporation jersey. We don't just include women, we put them in charge. In our assessment, we realized that women are already managing the home waste, but there is no authority. So we flipped the power dynamics. We selected 100% Waste Club members as women and girls. We empowered the world to manage the digital tools and data collection. By formalizing the roles, we transformed them from passive victim to flooding into active agents of our climate resilience. Next slide, please. Here is our some photos, our interactive session. Firstly, we took a workshop from where we got to know them, how they know about waste, how they are doing the waste segregation. So we train them about different waste materials, how the waste can segregation, and lastly validate their learning. We arranged a game. The game waste segregation game name was Konta Kothai in Bangla. Where is what we taught them in how to separate plastic effectively. The workshop concluded with a formal commitment that the 15 selected households pleased to segregate waste material and submit recyclable weekly to our Red Crescent Material Recovery Center that already situated in this area, shortly called MRF. Next slide, please. Here is our another activity. We selected the 15 members, and they are committed that they will recycle the waste. And we selected a weekly day in which they will put the waste into MRF center. And for your knowledge, MRF center is a center where the plastic product can be recycled into different product like slab or any that kind of thing. So that can give us some help in this regard so that we can segregate this waste into materials. Next slide, please. Here is our last activity. After we finished our waste management day-long training and activities, we arranged a workshop for them knowing what they can do to achieve resilience in the slum area. Here you can see them photos, and right up corner you can see the leaderboard. We didn't give them any economic benefit, as we prioritize that the economic if we can show them they are recognized for their contribution, we thought that they will be interested in more waste segregation. So we do that. Next slide, please. Here is our overall outcome. For a span of 1 month, we segregated 300 kg of plastic waste from critical drainage point and the community-led point to trash model, directly mitigating water quality and dengue risks over 50 plus vulnerable household. Women and youth-led government was ZC focus, established a sustainable waste management structure led by 15 trained resilient champions, 100% women and youth, transforming waste into some dignified and incentive-based activity. Lastly, we are focused on a smart slum model that deployed OpenStick technology and digitized hazard mapping and waste data. Next slide, please. Here is our overall outcome. We established 2 partnerships, one with Red Crescent Society and Gazebo City Corporation. We submitted a report to them. They assured us they will take some initiative regarding this. Our short-term outcome was we mapped 1,196 chain set in the OpenStreet map contribution. Next slide, please. Here is our partners, financial partners. We especially thank them for contributing in our project. Next slide, please. Here is a possible some challenge and roadblock. Initial risk was initial skepticism and data gaps. Door-to-door volunteer and trusted on networks. Doing that, we mitigate the strategy. Low community engagement. First, we feared that, but leveraging Red Crescent network and local leaders, we mitigate that. And lastly, logistical constraint and slum constraint. Adaptive localized planning and proven field models. We develop a good sustainable slum management tools. Next slide, please. Lastly, our scaling up project. So I can mention that how can we scale up our project. First of all, we can a geographical extension that we work in one zone. We can work in all the zones of the slum area. In technological integration, in technology integration, we can say our products work with like a puzzle piece, like integrating existing with the tech with OSM technology and sustainability. I think it will be a good integration in managing the overall and achieving the climate resilience. And lastly, sustainability. Every waste project that start with money end with money. We saw that many times. So we didn't provide money. We give them recognition, and here's the result. We successfully recycled 300 kg of plastic waste just span of 1 month. That's all from my side. Thank you for the time. Thank you.
So the next slide would be about general reactions about the all of the presenters. So I'll be calling Rahul from World Version Bangladesh, Didra from NetHope, and then Dana De Guzman from Hot Open Street. So Rahul, I'll pass it to you as you will be jumping off very soon.
Thank you, Miko, and thanks everyone for joining. I know for most of you, either in the Philippines or Singapore or Bangladesh, this is really late in the night. So it's an absolute privilege for me to represent World Vision here and share this moment with all of you on this culmination journey of the Climate Resilient Fellowship. I think this is a journey that began many, many months ago. With lots of challenges, lots of ideas, but also with a lot of hope as well. From the very beginning, I had the honor of walking alongside this initiative. Glad to have connected with this team, even during the earlier workshop that we had. Many times from the shaping of the concept to watching how some of this has grown. I think it was very good to witness the creative energy each of you actually brought into this capstone projects. I think it was very deeply meaningful experience, and I want to thank each and every one of you for your commitment. I think it takes real effort to do something like this, especially because many of you are balancing this fellowship also with full-time jobs. Some of you are studying, you had your own family responsibilities. I know some of you even had to travel abroad and get into your PhDs. So I think lots of pressures you had, and yet you stayed the course. And those of you who stayed the course, really, this is a mark of leadership. So congratulations on staying that. I'd like to actually appreciate Miko for hand-holding so many parts of this entire open street mapping part and the entire CRF process. Bernard, Honey, and the other colleagues from the Asia Pacific Hub and Human Street and Open Street Mapping team. I think it takes a lot of time, investment, and you actually had a steadfast belief in all of these young people. So thank you, Miko and team. Really big appreciation for that. I also want to thank NetHope for trusting this particular funding, for actually also to my leadership team for allowing World Vision to come on board. I think this is a real good collaboration. It was also in many ways for us a bold experiment of how we can give $1,000 to each buddies or these fellows to be able to come up with some new innovations and new ideas. While many of the projects are in the early stages, I think I'm very excited about at least 4 of the ideas that were presented here. I'd like to invite these teams to present your models to a group of urbanists, as I would call them, people who are very interested in urban planning and urban design from different organizations. We've met informally very recently, and they were asking about the CRF. So I'd like to invite you to World Vision offices sometime very soon, where we can all work out a particular timing, and I'll be in touch with Miko to coordinate this. And we look forward to actually seeing how your ideas can actually be evolved to be able to even look at scale, to even how we can fund it, how we can actually replicate this model, because at least 4 of the ideas that were presented here are quite good that we can look at. And I do hope for each of the teams here, I think the experience has given you more than just technical knowledge, because it gives you some grounded understanding of the field work that you need to do. I hope it has given you confidence. I think a confidence to lead, confidence to engage with communities, the confidence to innovate, to actually step forward and hold, and to be able to hold forward with a lot of trust and hope. So I think that is not an easy job, especially when you're getting into the development sector kind of work. So I encourage each of you, so whatever you've learned, to use it in your communities, in your workplaces, into your own future, into your own career journey. And I believe each of you have a strong potential. We as World Vision believe in your potential. We are proud of the growth that we have seen over these many months. And I hope you will continue to be champions of resilience wherever life takes you. So thank you, Miko. Thanks, Bernard. Thanks, Rahat, also for joining. Thank you, everyone, for your time. Really appreciate this.
Thank you, Rahul. Thank you also, everyone. May I call on next Dana? Are you there? To provide a mild reaction.
Yes, yes. So thank you very much to everyone for sharing your awesome projects. I was really happy to see data-driven planning and implementation across the boards. Particularly when presentation started with needs assessment, we already know that, hey, the problems you're trying to address are the urgent and real needs felt by the informal settlers there. So really happy to see projects like women-led segregation leading to circular economy, from identifying dengue breeding spots and like directly to action on preventing the breeding of mosquitoes, using local materials for repellents. Those are awesome actions, ideas that were put to reality by this group. So again, happy to see the different approaches addressing the complexity of enabling communities to lead climate resilient solution in slum areas. And all these stories coming from Dhaka, we're excited to learn more from you and hoping we could share this broader to other countries, other regions. Again, I want to acknowledge that going beyond the geodata analysis, I'm amazed to see that there was clear action from this group and hoping to learn more later on. Yeah, let me pass the floor back to Nico.
Thank you very much, Dana. I absolutely appreciate your reaction and staying up late for this session. It's very rare to catch you at this time. Last but not the least, may I pass the mic to our esteemed guest from NetHope, Gidraf. This wouldn't be here without your support, your guidance also, for your final reactions to the projects that you've seen.
All right. Thank you, Miko. And thank you, everyone, for the presentation. Yeah, sorry, I can't come on camera. I have really tried. I don't know what the problem is. Yeah, but I think, just as Dana and Rahul have mentioned, for me, it's also to see, I think I'm really glad to see, and I think I did start with that in terms of climate adaptation and resilience is very local. So we have to work on local solutions for local problems. And I think all the projects, did work on, inventions that are, that are for the communities that they have been designed for. So I'm really, really, happy about that. And also using a lot of data. So there's a lot of evidence and data used to come up with a project, which is remarkable because I think that really helps to solve a challenge within these communities, right? So one other thing, maybe what I'm thinking about is what I've noticed is that there will be overlap in terms of some projects with others. Maybe what we can think about is how we can, work together to make the products even, to make the the solutions even better, right? So that again, we're not working on, we may be working on different locations, perhaps, but you also do not want to work, in silos, right? So it is good to learn from all these presentations, have that in mind and also see opportunities for, working together with another team to make the solutions even better and, perhaps even, seek for funding together. And thank you for Rahul. I hope there will be opportunities for some of these projects, to move further into scale, or whatever that looks like, to reach out to more people and, to scale. So I'm really glad, Nico also and the team at Hot and the Open Mapping Hub, for, we have worked on this. I'm really, really glad that, we could come up with 10 very solid projects that potentially have the capacity to go and to go out and scale and create much more positive impact for communities within the localities that they are being implemented. Yeah, I'm so glad. So congratulations to all of you, and I'm really hoping that there will be a next step in terms of scaling these solutions to the next level for all for the communities that you work for and work with, because that's at the end of the day, it is for the communities to be able to build um, their own resilience and capacity to deal with the impacts of climate change. And have yourselves a good evening. Thank you very much. Back to you, Nico.
Thank you very much, Kid Raps. So as we wrap up our Community Resilience Fellowship tonight, I want to take a moment to celebrate and thank everyone who made this journey possible. So first, a huge round of applause for our incredible fellows. Your creativity, dedication, and courage over the past 6 months have been truly inspiring. You've shown what young leaders can achieve when passion meets action. To our mentors and trainers joining in remotely, thank you for guiding, coaching, giving the time, and supporting our fellows every step of the way. Your expertise has turned ideas into real projects with impact. To our partner, NetHope and World Vision Bangladesh, thank you for your unwavering support, for believing in our fellows, and for helping make this program a reality. And to all community members and participants joining us today, thank you for engaging, sharing ideas, and showing that together we can amplify local climate action. So over the past months, our 20 fellows were able to reach a total of more than 1,000 individuals, serving communities, households in the most vulnerable areas of our cities. These numbers are more than just statistics. They represent lives empowered, ideas sparked, and local action strengthened in the face of climate change. This is why programs like the Climate Resilience Fellowship matter, because investing in youth, in ideas, and in our future is not just a strategy, it is a necessity. Young leaders are the catalyst for change, and the innovators for solutions, and the ones who will carry our communities forward in resilience and hope. Tonight is not just a celebration, but it is a launch pad. The projects you've seen today are just the beginning. We hope they continue to grow, inspire, and spark even more actions across communities. In behalf of the Open Mapping Hub Asia Pacific and the Humanitarian OpenStreetMap team, we sincerely thank everyone who was involved in this journey. Our fellows, mentors, trainers, partners, and community members, your dedication and collaboration have made this program possible. Let's carry this energy forward, continue supporting young innovators, and invest in the ideas that will shape a safer, stronger, and more resilient future. So for the fellows, you can now sleep early. No, just kidding. Thank you very much, everyone, and congratulations again. Thank you, thank you. Have a great night, everyone, and sleep well.
Thank you.
Thank you. Good night.
Bye-bye.
Bye-bye.
Thank you,
Thank
everyone.
you, Nico,
Bye-bye.
Bernard. Thank you, everyone.